Welcome to the Wellness on Purpose podcast, your go-to source for impactful, educational, and realistic information designed to propel you forward on your journey to intentional well-being, not just for today, but for the well-being of future generations. Join us as we dive into insightful conversation with industry and brand leaders in the ever-evolving landscape of the health and wellness industry. Discover the latest trends, gain valuable perspectives, and uncover practical tips to elevate your wellness journey starting today. This podcast is brought to you by Joanne's Place Health Foods, your trusted partner in health, located in the heart of Peterborough and Lindsay, Ontario. I'm your host, Marissa Laughlin, and I'm thrilled to be guiding you through this season of the Wellness on Purpose podcast. Hello, everyone. Welcome back to the podcast. It's Marissa here. And yet again, I am so excited and happy to be here for today's episode because we have another amazing community practitioner joining us today. We have Courtney Cartmel, who is a registered acupuncturist, and she's also recently become a Pilates instructor. I also love Pilates, so excited to chat with her about that. And she has a passion for all things health and wellness, which you know everybody on our podcast does, but she is really leaning into supporting the nervous system within our community by offering acupuncture. And I actually don't know a whole lot about acupuncture, so I'm really excited to dive into this topic with Courtney and not only learn about the benefits and really what acupuncture is, but how it can support people who are dealing with imbalances in their gut and digestive health, as well as their brain health, because we know those two things are connected. So without further ado, join me in welcoming Courtney onto the podcast, and let's dive deep into all things acupuncture. Hello, Courtney. Welcome to the Wellness on Purpose podcast. How are you doing today?
I'm good, thank you. How are you?
I'm good, thank you. I am so excited to have you on our podcast today. So thank you so much for joining us. I know our listeners are going to be locked in for this episode because we've never had anyone talk about acupuncture on the podcast, and you're going to talk about all the benefits, and we're going to get into how it supports the gut and the brain and all of the things. But before we dive in, tell our listeners a little bit about yourself, because maybe they don't know you or they've seen your name come up on social media and they're curious. So give our listeners a rundown, who you are, where you're from, what you do.
Okay, my name's Courtney Cartmel. I currently live in Selwyn, Ontario. I work in Peterborough at Peterborough Center of Naturopathic Medicine, and I've been a registered acupuncturist for over 4 years now. So I'm going into my 5th year of practice, which is really exciting. I also recently became a Pilates instructor, so I'm kind of doing that on the side, which is a really fun creative outlet for me. So it's really just, all things kind of health and wellness that my life is. And I really try to practice what I preach. And yeah, that's kind of who I am and what I do.
Love it. And I also love how common it is for anyone in the health and wellness space to have multiple different avenues for health and wellness. We see it so frequently, and we've had so many different practitioners on the podcast, and they have so much secondary training. So I love that you mentioned that you do Pilates. It's I think a natural thing for entrepreneurs to want to try to have different levels of experience and understand the body better. So love to see that that's incorporated into who you are and what you do in our community as well. So I love that. Now let's get into acupuncture, because I'm going to be completely transparent. I've never really done an acupuncture treatment except for dry needle injury. So I think that's
Okay.
completely different. And I
Yes.
don't know if people really know what acupuncture is, the benefits, and all of those things. So let's start with the basics. What is acupuncture and how does it work?
Okay, so acupuncture is a form of ancient traditional Chinese medicine. So we're inserting fine needles into specific points on the body. These points are located along pathways on the body. These are called meridians. So you can picture these like highways on your body. These help regulate the flow of energy, which we call qi in Chinese medicine. And by stimulating these specific acupuncture points, it helps restore balance in the body, which promotes healing and supports overall well-being. And we do have sort of like a Western idea of things now that they have done more research. So it does help influence the nervous system. It improves circulation, reduces inflammation. It can lower heart rate. It can help with blood pressure. So there actually are these quantifiable things that they are able to measure. They've done like MRIs after somebody has had acupuncture, and they do see a difference in kind of how the body's moving. So we do have these ancient explanations of it, but the research is growing, which is very cool for people, especially who are skeptical and kind of come from a very like Western brain.
I love that. And I think it's so important that this is evolving to see more research and actually have as you said, that quantifying measurement of it improving somebody's health. Because when I first heard about acupuncture, I only just pictured relaxation, really
Yeah.
activating that parasympathetic nervous system, which I believe it does, but I didn't realize how many different benefits that can come with it. And I wanted to speak to you specifically about the gut and as well as the brain, because we know they're connected. And the reason that I feel like this is an important topic is because we have so many people that come into Joanne's place that those would probably be the top two ailments that we see people looking to
Yeah.
support. Their gut is not doing well. They may be suffering with IBS, allergies, a lot of gas, a lot of bloating, but that actually tends to go hand in hand with people who are also saying their next symptoms that they're experiencing are anxiety, maybe mood fluctuations. I wouldn't say like full depression, but just like not seeing, the positive side of things. Like there's a lot of things that go intertwined for gut and brain. So I wanted to know what your point of view was in terms of using acupuncture, and if you see these types of clients in your practice and what that looks like.
I feel like people come in and they have like digestive concerns or they have anxiety, but they do often go hand in hand. We know that the majority of our neurotransmitters are made in the gut. So if our gut's not doing well, our brain's not going to be doing well. And if our brain's not doing well, our gut's not doing well. So it's really just sort of this vicious cycle that unless we get something under control, then it's just going to potentially get worse for somebody. And a lot of that does come down to calming the nervous system. As you mentioned, getting ourselves into that parasympathetic, we call it rest and digest, right? Which is digestion. So we need to kind of calm the body down for these things to happen. And acupuncture is a really excellent medium for getting the body into that state. So that is kind of how they are connected in that way. I do see a lot of IBS, acid reflux, bloating, constipation, and even food sensitivities. People who have like excess histamine in the body. You did mention allergies. So acupuncture can help with that as well. Things like hay fever, just allergies like out and about, but also foods that people get triggered by as well.
So you just named off some of the more common gut related issues, especially allergies, bloating, IBS, acid reflux, things like that. So when someone comes and sees you, like what does that look like for a traditional appointment with you to kind of tackle those gut related issues?
Yeah, absolutely. So somebody comes in and I do an intake appointment. So I ask them a lot of different questions about their health, a lot of having to do with, are they have bloating, gas, discomfort in their abdomen? Do they have acid reflux, constipation, diarrhea? What does that sort of look like for them? So somebody who may be coming in with constipation may also be coming in with bloating. And in traditional Chinese medicine, that's something that we'll often call liver qi stagnation. So when your qi's not moving, that often will be that you're constipated, you're ultimately not evacuating your bowels, and you may also have bloating because things are sort of stagnant and not moving. Sometimes when people have more loose stools and sometimes a poor appetite, they sort of go hand in hand, as well as fatigue, is spleen chi deficiency. So depending how people present to me, I see patterns. So they tell me that they're experiencing certain symptoms, and then I would choose my points according to that. So there are a lot of general points on the body that I will use on a lot of patients that come in that are supportive of moving their digestion along, helping with, acute things like acid reflux. that they may be experiencing. So it really comes down to patterns. I do tongue and pulse diagnosis as well. So that kind of paints the whole picture together. So looking at somebody's tongue and checking their pulse gives me an idea of how things are working, what their digestion looks like. If somebody comes in with a swollen tongue that has those like teeth marks, the scallops on the side, often that is a spleen qi deficiency. So they may have also a little bit more dampness in their body. I may recommend that they lay off dairy a little bit. Are they eating a lot of fried foods, things like that? Red along the edges of the tongue. That's the area of the liver and gallbladder. So that would be liver qi stagnation. So as I mentioned, the sort of constipation and bloating. So it really all comes down, as I said, to patterns and how somebody is presenting and then how I would treat them. So most of the acupuncture points that I use are below the knees and below the elbows. But there are points all over the body, the head, the face, the abdomen, the back. So it really just depends, their comfort level too. Some people don't like certain areas of their body touched, and then just how they're presenting as well. So I make my decision based on that.
Amazing. There's so many like different markers that I think people don't even realize. Like, I know, as you said, the tongue, there's the eyes, there's so many different things that can tell what is going on with the body. Quick pause in today's episode because I want to talk to you about a transformational online program. In case you missed it, Joanne's Place released an online program called the Wellness on Purpose Program to Educate You last year. And our intention with this program is to make this education more accessible for our community to better support their wellness journeys. This program promotes sustainable and realistic changes, and it really focuses on the foundational pillars of every single person's health: your nutrition, your sleep, your stress, and also movement. If you want to get started today, click the link in the description below to learn more about the Wellness on Purpose program. By the way, it's completely free, and you can move at your own pace from the comfort of your own home. Now let's get back to the episode. So I want to flip to the other side of the topic here, which is the brain. As we know, the gut, the brain, they're connected. They work synergistically together. When we have one imbalance, we need to look at the other and vice versa. So when we're talking about the brain specifically for acupuncture, are we talking like more or less conditions like mood dysfunction, anxiety, things like that? Or would you relate more to or see more patients that would be talking about, symptoms related to brain, like brain fog, memory, lack of clarity, fatigue, or could it be a bit of both?
I would definitely say a bit of both. I think sometimes people can't put into words also what they're feeling. I think sometimes they're like, I feel off, and they just, can't maybe explain that. And I'm like, is that brain fog? What exactly does that mean to you? Definitely, talking about like mental health things like anxiety and depression can be sensitive for people. They're not necessarily really comfortable to be as forthcoming with that information. So I try to approach it in a way that's kind of gentle for them and, see if they're, open to disclosing. I say, like, what are your stress levels like? How does that present with you? I do find a lot of people will have kind of a default emotion as well. And that also is works with that pattern that I was talking about. So looking at conditions, I'm looking for patterns in somebody. So somebody that's quick to anger, versus maybe somebody that's more like a sad or kind of like a weepy person. What is your kind of default emotion? I feel like people, there's kind of an angry, maybe presenting person, or maybe someone that's a little bit more anxious. And I kind of try to find out exactly what they're kind of suffering with and how their body presents emotions and how that sort of looks like for them. But I do definitely see a lot of connections. If somebody's presenting with anger and constipation, that makes sense to me. That's that liver qi stagnation. If somebody is a little bit more anxious, that may look like something else, and that might be a little bit more diving in to see why is that? Is it lifestyle? What exactly is happening?
Interesting. There's so many like underlying connections. Like as I said, like that we don't really even understand. Like as an average individual, obviously you as a practitioner would understand. But there's so many connections. So interesting. So if you had a patient come to you and say their symptoms were constipation, anger, just as you said, that kind of liver
Yeah.
imbalance and they're looking to improve that both of those issues with acupuncture. How long do you think somebody would need to receive acupuncture to see a benefit?
So it really depends how long they've been experiencing something for. If something's more chronic, I always tell people if it didn't happen overnight, it's not going to get fixed overnight. So that usually is a little bit longer. I will always start with 90% of my patients. I like to see them at least 4 times close together. So whether that's once or twice a week, and then we kind of reevaluate at that point. So I would say like 4 to 6 treatments. I see most people their symptoms get under control, unless it is something like very chronic that's been happening, or if it's a structural issue. I'll find if somebody isn't getting better after, 4 to 6 treatments, things aren't moving in their gut, they're still constipated, then is there a structural issue going on? Is there something that's actually wrong in their body that can't be fixed, with diet and movement and acupuncture? That there is something that needs further investigation. So usually 4 to 6, I'll see people. And then I will see most of my patients once a month, kind of for like a maintenance and sort of a tune-up treatment. And that is where I see the healthiest, happiest patients are the ones that follow my treatment plan. They see me, 4 to 6 times, and then they come once a month and things are good. They come in and we're just kind of working on maintenance. But it is important to get the appointments close together because each appointment builds off of one another. So it has a cumulative effect.
Amazing. I also loved that you mentioned your patients are the happiest and healthy when they follow your treatment plan because as a nutritionist, I have also done lots of consulting with people, and we want immediate results
Yeah.
for that to happen, and it doesn't happen. If you've been doing something for 10 plus years, honestly, even a year, the same thing over and over again for a year that's led to a symptom or something out of balance is not going to take one treatment. It's not going to take one thing either. Like I'm sure your treatment plans probably look like, because you just mentioned, lifestyle factors, food factors, your entire way you carry yourself day to day is going to have a positive effect when you start to change your habits. So I'm sure that's the same for acupuncture as well. You need to look at what is also, contributing to your symptoms and how we can
Mhm.
improve them, correct?
Yeah, exactly.
Yeah, love that. Okay, so close appointments and then maintenance appointments. I love that. I feel like that's very sustainable. So when you do get new patients that come into your office, what is the most frequently asked question about acupuncture?
I think one of the most common questions of is does it hurt? Which most people are really surprised. And, oftentimes I will pull out a needle and I'll show them what it looks like. I'll let them touch it. That kind of reduces sort of that fear around it, that kind of unknown. Most people are used to, like a flu shot or like having their blood taken. You can fit like 10 acupuncture needles into one of those needles. Their acupuncture needles are only as wide as a couple strands of hair. They're very, very thin. So oftentimes you won't bleed when these go in, where other times you will, with larger needles. So most of the time there isn't any bleeding in the area. It's really uncommon to even get a bruise from an acupuncture needle unless it's in a very sensitive area. So I think that's probably the most common is does it hurt? Most people find it really comfortable and they're quite relaxed. I think maybe sometimes in the first couple treatments, if people are really anxious and they're kind of heightened and they're really worried and they're tensing their body, they may feel a little bit more, but they will feel less and less as the treatments go on, if anything. Sometimes they'll come in for their first treatment and they're pretty calm and they're like, "Oh, did you put a needle in? I had no idea." That's a very, very common response. They're always surprised, but it is just kind of this fear. People say needles, I don't like needles, but these are different. They're just so much smaller. There's like maybe like a warmth or a heaviness around the needle, which is a response we want. We want you to feel something sometimes, but it's rarely actually painful. So that's probably the most common question. And I think what keeps people out of my office and often is why I'm kind of sort of a last resort. They're like, I've tried everything. I'm going to try acupuncture. I don't really want to. And then sometimes it's kind of the thing that they need that has been missing from their routine.
Yeah, I know it's missing from my routine as we're having this conversation. I like to try everything once for sure.
Yeah.
But when somebody is coming in for a treatment, how long are these needles staying in? Is it dependent on what ailment you're taking? Is it 5 minutes? Is it 30 minutes? Like how long would a typical session be?
I would say generally 20 minutes, sometimes a little bit longer if somebody is, maybe they have like really bad acute back pain and they're really just uncomfortable. They're not able to lay in a certain position for very long, or they're really kind of nervous. I sometimes will stay in the room with them, but typically for best results, I will leave because people don't feel as comfortable when somebody else is around. And that allows them to relax more, settle in, and let the needles kind of do their thing. So they do need to be in for some time, which is again a huge difference between what a lot of people have had dry needling, they're in and they're out and they're kind of stimulating the point, doing the dry needling. But I usually put them in and then leave them in and let them do their thing. So 20 minutes is pretty average, I would say.
Okay. So as a new patient coming in, what is like the one piece of advice that you would give to me to kind of get started before our session? Is there anything that should be done in prep for an appointment, or is it you come as you are, we figure out what you need and go from there?
For the most part, people just come in. I see people at all times of day. Some people get a little bit tired after their treatment. So sometimes I'll say, like, maybe don't go back to work after if you can, maybe come at the end of your work day or if it's a day that you have off. Some people feel, it kind of energizes them and they feel good. But I would say like loose fitting clothing, don't come on an empty stomach. That can, if there's any sort of side effects or potentially any lightheadedness, which is very rare, but if you're already anxious, you haven't eaten anything, having a lot of caffeine before or after your treatment can definitely impair things because we're trying to activate your parasympathetic nervous system and those ramp up your sympathetic nervous system. So coming to the appointment, filling out your intake form and really just, yeah, coming as you are, maybe not after like a really large meal that you may be uncomfortable, if you're laying on your stomach potentially, but there isn't really any prep by any means.
Okay, good to know. I know you briefly mentioned, and I talked about too, that there is a treatment plan that you're going to provide kind of to each of your patients, depending on what you are looking to achieve. So,
Yeah.
in general, without talking about any type of ailment at all, would you say that there are specific lifestyle habits that you feel really enhance the benefits of acupuncture, whether they're doing that like before or after a treatment or just like day to day in general?
Yeah, I mean, I really like to come down to the foundations. So getting people drinking adequate water, that's it is challenging for some people, but one of the easiest changes you can make, ensuring that you're getting enough water, which is crucial for everything, particularly digestion. Walking, if you can, like any sort of movement, exercise. Walking after meals is really supportive of digestion. So people with bloating, if they go for a short walk after a meal, I find that their bloating is almost gone because things are able to move a little bit more. If they're open to things like meditation, breath work, journaling, that kind of thing, that can help with their nervous system as well. So I think incorporating, any sort of healthy lifestyle changes in regard to digestion, cold and raw foods can impair the digestion. So if somebody comes in, they're having digestive concerns and they're having a smoothie for breakfast every day and a salad for lunch, then I'm thinking, maybe let's, try some oatmeal. Let's try maybe like some soups or some cooked foods, which are a lot more supportive of the digestion. So it does depend kind of what they're coming in for, but a lot of times I am giving the same advice over and over, which is, to take care of your body, the foundations, eating at regular intervals, and then how you're kind of consuming your food and ensuring you're doing that in a mindful way. So, chewing really slowly is important. That helps our saliva produce, which has digestive enzymes in it. The smaller your food is also going to be easier for your body to digest. If you're eating really fast, which I think a lot of people eat really fast, I'm telling people to slow down their eating, try to eat in a quiet environment without distractions of their phone and computers because they're not going to be as mindful. You're going to get more air in your stomach when you do that. So that's going to definitely impair things as well. Yeah, so a lot of just like those general things, but really depends kind of what they're coming in for. But I would say 90% of people could definitely benefit from eating slower, regardless of if they're having digestive concerns or not.
Yeah, I think pace of eating is huge. And
Mhm.
like as I said, as a nutritionist, the
Yeah.
basics are where you start, and nobody wants to start there. No one, everyone's like,
Mhm.
"Ugh, that's too easy," but I still don't do it. And it's like
Yeah.
just eat away from your computer, eat slower, eat less distracted, put your phone away. Like that
Mhm.
alone can make such a significant difference in not just digestion, because I think people think digestion is like, things moving through your system, but
Yeah.
it's also what you're absorbing from what you're digesting as well. So better
Mhm.
absorption, more mineral and vitamin uptake, all of those things. So it's not just digestion, it's also absorption, assimilation,
Yeah.
growth, healing, all of those things. So, so simple, but yet so many people are not able to do it. And I'm guilty too. I literally ate my
Yeah.
lunch at my computer yesterday. So it's a good
Yeah.
reminder. What about specific products? Like, do you think that there is some things on the market that would be really supportive for, again, just like a general overall well-being, to also enhance the benefits of acupuncture?
I love herbal teas. I love herbal teas for three reasons. So, having cold drinks, cold beverages, a lot of people will have, ice in their drinks. That's going to impair your digestion, is going to introduce cold into your body. Your body is, 36 degrees-ish. A cold cup of water is maybe 5 degrees, maybe colder, and you're introducing that into your body. That's going to be really hard for your body to absorb and digest, and that's going to kind of shock your stomach. So, not having cold drinks and having herbal teas, having more warming fluids is really supportive. They also add to your fluid intake for the day. So, people are like, oh, well, I have coffee or I have tea, caffeinated things. That's not hydrating your body at all. So herbal teas are going to be supportive. I like things like fennel for bloating. Fennel tea is great for that. It relaxes the muscles in the digestive tract. For things like acid reflux, chamomile and slippery elm can be really helpful. Peppermint can also help with bloating and gas. The caveat with peppermint is that if you do have acid reflux, it can sometimes make it worse with people, like mint anything, because it can be quite strong. I also love ginger. I recommend ginger for so many things. It helps warm the digestive tract. As I said, having cooling things in the body impairs your digestion. So ginger's going to warm things up. It helps with inflammation. It promotes movement. And then any sort of nausea that anyone may be experiencing, ginger, ginger tea is incredible. So I really, really like to recommend herbal teas for people because it's good for so many things. Yeah, and I know that you guys carry a lot of those products at Joann's, and I love the herbal tea section. It's wonderful.
I'm also a big tea drinker. Like I probably have 3 to 4 different cups of herbal teas. Sometimes it's just like the same tea bag of like peppermint,
Yeah.
like something gentle. But I am a big tea drinker, especially through the winter because I don't love water. Like I will
Hmm.
drink so much water when the weather is warm out, but it's really hard for me to get my proper water intake. So I do use herbal teas. And yeah, as you said, Joanne's Place has lots of options. We've got traditional medicines, stash tea, clay de champ. We've got organic traditions in loose bulk. There's so many options. So
Yeah,
very easy, accessible. And the other thing I really like about teas is they're not super expensive. Like
exactly.
they're yes, more than Tetley tea, black tea, but that's not a medicinal tea. But they are an affordable way to get medicinal benefits without having to supplement. So I really, really, really like, and you can also get fresh herbs, like especially in the
Yes.
season. So, I love that. So amazing. Wow, we covered a lot in this episode, and it's so informational. Again, like I didn't know anything about acupuncture. I didn't know how many things were connected through the body. I know we talked a lot about gut and brain, but you treat a lot of different patients, I'm sure hormones, stress, lots of different things, which is amazing. So for our listeners who want to try adding acupuncture into their wellness routine, where can they find you? Everything from where they can book an appointment to where they can find you on socials. Tell us all about how we follow up.
Okay, so you can find me on Instagram, CourtneyCartmel.acu, Facebook, Courtney Cartmel Acupuncture. My website is CourtneyCartmel.ca. I'm located in East City, as I said, so I'm on the corner of Hunter and Burnham, and I'm at Peterborough Center of Naturopathic Medicine. So you can contact us there from our website or on my website. There's online booking available. So the links are pretty easy to find, which are also on my Instagram and my Facebook. So it's pretty much everywhere. You know, if you just Google my name, you'll see my Google profile, all of the bookings there, the phone number to contact the clinic. I have a work email that you can contact me at Acu with Courtney. Yeah, so pretty much anywhere and everywhere. But if you reach out, you know, everyone kind of has their preferred way. Yeah, just shoot me a message if you have any questions or anything like that. Good place to start. I do offer complimentary appointments as well. So a 10-minute meet and greet style appointment. So if somebody wants to chat about specific concerns, they have some questions, they're not sure if acupuncture is, you know, the right fit for them, then they can book something like that, a phone call, or they can come in and meet me and we can sort of chat about that and see if we'd be a good fit.
Awesome. I love that. So for our listeners, I will leave those links in the description for people to access and book in with Courtney. Courtney, thank you so much for joining us on the Wellness on Purpose podcast today. As I said, we covered a lot of grounds about acupuncture, and I think this is a really supportive tool for our community to just better support themselves, whether they are dealing with digestive or gut health issues, or, you know, looking at fatigue, brain fog, or other elements. Again, I don't necessarily, at this point, struggling with any symptoms, but I just want to see the benefits for relaxation. And as you said, like activating that parasympathetic nervous system. So I think it's suitable for everybody, which is amazing. So thank you so much for sharing about all things acupuncture and about yourself today. It's been a pleasure.
Thank you so much for having me.
Thank you for joining us for another insightful episode of the Wellness on Purpose podcast. We hope you found the information valuable and inspiring to support you along your wellness journey. Before we go, a quick reminder. The content shared in this podcast is for educational purposes only. While we strive to provide accurate and up-to-date information, it's important to remember that everyone's health journey is unique. We strongly recommend consulting with your healthcare professional or a qualified health practitioner for personalized advice tailored to your specific needs and circumstances. Your well-being is a priority, and speaking to a healthcare professional ensures that you receive guidance that best aligns with your individualized health goals. If you have any questions or topics you'd like us to cover in future episodes, please reach out to us through our website. That's all for now. I hope you stay well, stay informed, and remember, your health is your greatest wealth. Until next time, take care.